Good evening, guys. Tonight's discussion is about holistic wellness. Okay, achieving holistic wellness. So we'll get into that for tonight. So please join me in tonight's presentation. Here we go. The phrase mind, body, and spirit, 8 essential tips for achieving holistic wellness, refers to a video and offers guidance on how to live a more balanced and fulfilling life by nurturing all aspects of your being, mental, physical, and spiritual. Based on the surrounding page content, here's what it is all about. Holistic wellness is the central theme, emphasizing the integration of mental health, physical well-being, and spiritual growth. The video outlines eight key tips designed to help viewers achieve harmony across these 3 dimensions. While the exact tips aren't listed on the page content, the focus is clearly on self-care practices. That support a more fulfilling and harmonious life. It encourages viewers to balance their inner and outer worlds, suggesting that true wellness comes from aligning thoughts, actions, and beliefs. In essence, it's not just about eating well or exercising, it's about cultivating mindfulness, emotional resilience, and a sense of purpose. Think of it as a blueprint for thriving, not just surviving. Would you like me to suggest what those 8 tips might include based on common holistic wellness practices? Holistic wellness and traditional wellness differ in how they view health, treat illness, and engage with the individual. Here's a breakdown of the key distinctions. Holistic wellness, whole person approach. Focus treats the mind, body, and spirit as interconnected parts of a whole. Philosophy, health is about balance and harmony across all areas of life. Treatment style emphasizes prevention and root cause healing. Use therapies like acupuncture, herbal medicine, nutrition, counseling, and mindfulness practices. Patient role encourages active participation in healing. Patients are collaborators, not just participants or recipients. Goal: long-term wellness and personal empowerment. Feature holistic wellness, traditional wellness. Scope: mind, body, spirit, physical health. Approach: prevent and integrative, reactive, and specialized. Treatment: natural therapies, lifestyle changes, medication, and clinical procedures. Patient involvement, collaborative and personalized, provider led, and standardized. Outcome: focus, balance, and vitality, symptom relief, and disease control. Holistic wellness doesn't reject traditional methods. It often it often complements them, but it shifts the lens from what is wrong to what's out of balance, and how can we restore it. Would you like to explore how to apply holistic wellness in your own life? I can help you. I can help tailor a plan based on your goals. Holistic wellness has gained popularity for its whole person approach, but is not but it's not without its critics. Here's a breakdown of the most common concerns. Lack of scientific evidence. Many holistic treatments like energy healing, herbal remedies, and certain detox protocols haven't undergone rigorous clinical trials. Critics argue that without randomized controlled studies, it's hard to verify their safety and effectiveness. Safety risks. Some holistic therapies may interact negatively with conventional medications. Unregulated treatments or advice from non licensed practitioners can lead to delayed or inappropriate care. Cost and accessibility. Holistic wellness services can be expensive and are not covered by insurance. This creates a barrier for low income individuals and raises concerns about wellness becoming luxury commodity. Overemphasis on individual responsibility. Wellness wellness culture sometimes promotes the idea that health is entirely within personal control, ignoring systematic issues like poverty, discrimination, or access to care. This can lead to guilt, shame when people struggle with health despite their efforts, toxic uh, positivity, and commercialization. The wellness industry is often criticized for pushing unrealistic standards of happiness and health. Influencer driven marketing can promote superficial fixes like expensive supplements or trendy diets over evidence based care. Cultural over amplification or simplification. Sometimes wellness models overlook cultural, uh, historical, and societal, social economic factors that shape health. Critics argue that concepts like spirituality and self direction are treated too universally without accounting for diverse worldviews. Holistic wellness isn't inherently flawed, it's the way it's practiced and marketed that draws scrutiny when integrated thoughtfully with conventional medicine. It can offer powerful benefits, but it's important to stay informed and critical, especially when your health is on the line. What help evaluating a specific wellness practice or product? I can dig into the evidence you for you. Holistic wellness is often seen as intrusive or uh, accidental, but there's a growing body of scientific evidence backing many of its core practices. Here is a breakdown of the most uh, compelling research supported areas. Mind and body practices, mindfulness meditation. Studies show it reduces stress, improves emotional regulation, and even accelerates healing in conditions like psoriasis. Yoga research led by Bauer et al. Found that yoga reduces inflammatory signaling in fatigued breast cancer survivors. Acupuncture clinical trials support its effectiveness in managing chronic pain, uh, migraines, and stress related disorders. Clinical nutrition. Holistic nutrition emphasizes whole foods and personalized diets. Studies by uh, Monzafran et al. show that dietary changes significantly impact long-term weight management and chronic disease prevention. Integrative approaches combine modern nutritional science with traditional systems like Ayurveda or traditional Chinese medicine, offering tailored healing strategies. Functional and integrative medicine. These frameworks use personalized diagnostics to address root causes of illness like inflammation, hormonal imbalance, or gut symbiosis rather than just treating symptoms. Evidence from fields like colon, Crohn biology and metabolic health supports in, in intravenous like restricted eating and circadian rhythm alignment for improved health outcomes. Neuroscience and stress reduction. Chronic stress is linked to heart disease, obesity, and immune dysfunction. Holistic methods such as breath work, guided imagery, and nature therapy have shown measurable benefits in reducing cortisol levels and improving resilience. Scientific integration. Modern healthcare is increasingly adopting evidence based holistic practices, blending them with conventional treatments to enhance outcomes. This indicates standardized protocols. This includes standardized protocols and clinical validation to ensure safety and effectiveness. Holistic wellness isn't just about feel good philosophy. It becomes a data driven discipline. The key to the key is to choose approaches that are backed by research and tailored to your unique needs. Want help building a wellness plan that's both holistic and evidence based? I'd love to help you design one. Functional medicine and conventional medicine offer distinct philosophies and approaches to healthcare. Here's a clearer breakdown of how they differ. Functional medicine, root cause, personalized care. Philosophy focuses on identifying and treating the underlying causes of illness rather than just managing symptoms. Approach treats the body as an interconnected system, considers genetics, environmental, lifestyle, and emotional health, uses personalized plans involving nutrition, stress management, sleep, and movement. Give me 1 second, guys, please. Okay, strengths. Ideal for chronic conditions like autoimmune disorders, fatigue, and digestive issues. Okay, emphasizes prevention and long-term wellness. Practitioner role, acts as health partner, often spending more time understanding the patient's full story. Conventional medicine, symptom-based standardized care. Philosophy focuses on diagnosing and treating disease using established protocols. Approach relies heavily on pharmaceuticals, surgery, and diagnostic testing. Specialized in acute care and emergency interventions, often compartmentalizes care, e.g., cardiologist for heart, dermatologist for skin. Strengths, high effective for trauma, infections, and life-threatening conditions, backed by intensive scientific research and standardized guidelines. Practitioner role follows clinical protocols to manage symptoms and disease progression. Comparison table. Feature functional medicine, conventional medicine. Focus, root causes and whole body balance, system and disease management. Treatment style, personalized lifestyle based standardized pharmaceutical surgical. Ideal for chronic condition prevention, acute care, emergencies. Patient involvement, high collaborative and proactive, moderate provider led. Diagnostic tools, integrative labs, lifestyle analysis, imaging, blood tests, clinical exams. Time with practitioner longer, in depth. Consultations shorter, protocol driven visits. Functional medicine doesn't aim to replace conventional medicine, it often complements it. The key difference lies in how health is defined and pursued. Functional medicine sees optimal wellness, while conventional medicine often aims to restore baseline health. Curious how these approaches might apply to specific conditions or concerns you have. I can help you explore that. Patients who engage with holistic and functional medicine often report feeling more empowered, heard, and actively involved in their health journey. Here's a snapshot of how they typically describe their experiences. Common patient statements. positive experience. Empowerment and control. Many patients appreciate being treated as a whole individual rather than a collection of symptoms. They feel more in control of their health decisions. Prioritized attention. Functional medicine practitioners often spend significantly more time with patients, uh, diving deeper into lifestyle history and emotional well-being. Root cause relief. Patients dealing with chronic conditions like fatigue, digestive issues, and autoimmune disorders often find relief when underlying causes are addressed, not just symptoms. Collaborative care. The relationship feels more like a partnership with practitioners guiding rather than dictating care. Challenges and criticisms. Cost and accessibility. These approaches can be expensive and are often not covered by insurance, which can be frustrating for patients seeking long term care. Okay, guys, so that is C for you. I'll try and do a D in a little bit. Okay, I'll be back on shortly with that for you. For now, Gator Wellness, take care, folks.